New at 11, it's not just San Francisco. Many kids across the Bay Area have been out of the classroom for almost a year now, and it's taking a toll. KPIX5's Andrea Nakano joins us from San Rafael High School with what Marin County is doing to address teens' mental health. Andrea?
Yeah, Liz, what's unique here in Marin County is high school students from schools like San Rafael High here have opened up the conversation about mental health. They have teamed up with the Marin County Office of Education to offer a speaker series to help those struggling with mental health.
Hi, my name's Talia. I'm a sophomore at San Rafael High School.
Talia Harder is one of the organizers of the Marin County High School Student Virtual Wellness Speaker Series.
I also saw somebody else shared something really incredible as well. This was also anonymously. A moment when I felt like I was overwhelmed with emotion and didn't have the support I needed was after my first suicide attempt, when I was getting yelled at by the people who were supposed to support me.
This particular event was called More Than Sad, hosted by the American Foundation for Suicide Prevention.
I would definitely say the depression and anxiety, especially in the wake of COVID-19, has been really difficult for a lot of teenagers because a lot of our support systems that we normally would have are gone.
According to a study out of UCLA, nearly half of California teens between the ages of 12 and 17 have recently struggled with mental health issues, and psychologists are seeing an uptick in patients.
We're seeing tons of depression. We're seeing some kids who are really struggling with anxiety.
Dr. Allison Holmes-Knight is a clinical director at Daybreak Health, an online counseling platform to specifically address teen mental health.
I remind them that they're not alone and that none of us were actually prepared or built for this type of pandemic and this type of isolation from other people.
And that's the goal of the speaker series, to create a support system and let teens know there is help.
If we can help one person, like one at all, with any of these, that would be enough.
Dr. Knight Holmes says even as restrictions are being eased and some students are returning to school, she expects these effects from mental health to linger. She says students, especially in high school, have lost a year of their lives that they will never get back. Liz?
It's been so hard on so many people, but hopefully, there is light at the end of the tunnel and there is hope. Andrea, thank you.